all in Foxy Presidential Initiative podcast series, Gyan Pravah. Today is the episode number 281. And today, on the occasion of Dev Diwali and Guru Parab, I feel humbled to present this episode. An inspiring initiative by our dear president gifting us the wings to reach new horizon. ज्ञान का बहता रोजाना एक नया अनोखा रंग. हर रात 8 बजे जुड़िए आप सब फॉक्सी के संग. Madam has capacity to translate a vision into reality, and we are seeing this 281 episode today. Honored to be part of this initiative under the visionary leadership of President Foxy, Dr. Sunita Tandulwadkar, Madam. We all saw the girls have created history after this winning World Cup. Girls prove that they are not defined by limitations but are destined to greatness and resilience. We as society, if extend support and guidance, great miracles can happen. So I thought of taking this subject with renowned pediatrician Dr. Vasant Khalatkar sir, who is President IAP in 2025. Today, this month is the Children's Day month also. So as gynecologists, we always honor pediatrician, and on the occasion of Children's Day, which though I am supposed to do podcast on 5th, so in the month of November, we just thought of this topic. Before proceeding, I would like to give official intro of my beloved president who always believe in women empowerment and working tirelessly on women health issues. We are blessed to have her as our guide. Madam, this is very short intro because I know when
No,
want to,
I don't like my introduction. You know
but
that.
Dr. Sunita Tandulwadkar, Madam, a visionary who has redefined reproductive medicine with excellence, resilience, and innovation. She is a pioneer in reproductive medicine, renowned for her groundbreaking achievement of delivering India's first stem cell baby and world's first at the age of 45. She serves as a head of the department OBGYN and Endoscopy Center at Ruby Hall Clinic, Pune, and is the founder and medical director of Solo Clinic IVF, as well as co-founder and medical director of Alive, a stem cell research and center.
Jyoti,
Yes, madam, I just seek your blessing. I know you are
thank you.
traveling for the same cause. You are having a good initiative, Sampurn initiative, and it is just we came to know that there are so many trained personal staff and technicians and we are nurses. Everybody you are training under your Sampurna initiative, and this is a actually very big step towards the women health. Madam, for your blessings, we just
Thank you, Jyoti. Thank you so much. And welcome, Dr. Vasan, sir. We met several occasions in this year on various Zoom platform because of preceding gynec and pediatric always goes hand in hand. And it's always pleasure 280 plus Gyan Pravah podcast series every day is a phenomenal job my girls are doing. I should not say only girls because I have boys also, 30 chairpersons. They will be so upset with me if I say only girls because ये ज्योति ने girls डाल दिया. The girls won the World Cup. But most importantly is I was thinking ki this is to give a empowerment to my chairperson. They get a platform on one fixed day every month where they can have a freedom whom they should interview, what they should be talking, just to develop their leadership quality because these all are our future presidents of Foxy. This is the first step they have to do 3 years of a committee chairperson. But believe me, Dr. Vasant, it was complete evolution of my thinking. I have met 280 plus faculty every day at 8 p.m. I join just to show the respect to the faculty that they have taken out their valuable time for Foxy and Foxy respects that and feel grateful to have you. Meeting all of them, I realize life is so beautiful beyond. There is so much more to do in every field, not only our medical field, but non medical. So many political, spiritual, philosophical, social background. We are the leaders global, and the way they are working is huge. I think these, I don't know what we will do with these 365 podcasts, but definitely I'm looking forward to have this intellectual property to be permanently encarved and do something out of it. Now, Jyoti, I'm sure your podcast will be fantastic. I wish you all the best. And living for Agartala, that is another thing what was very important for me, reaching to the unreached areas. That's why with the Tripura, I have started this with Sampurna, where we cover antenatal and intrapartum, and myself going to Agartala tomorrow to have a meeting with state authority, with the district authorities, to oversee the program and to appreciate the efforts of our team member who are going all the way there and working. It's important for me to be there with them. Thank you.
Thank you.
Enjoy. I'll join the viewers link, Dr. Vasant, and
Yeah,
listen to both of you from there.
And
no,
Thank you.
no
Vanji,
issue.
Thank you.
thank you, madam, for your blessings. Actually, it was your vision. You just wanted every woman, she should be having the healthy life to just deliver a healthy baby, and that's why we are just dependent upon our pediatrician since birth, first breath to adolescent of the age. And I am thankful to Dr. Pragati Khalatkar who made it possible. So, sir, now it is time to welcome you on the official platform of Foxy. And welcome to Born to Rise, a podcast dedicated to nurturing every girl's journey, from her first breath to her teenage dreams. Today, we explore the health, strength, and limitless potential of every girl child. And for that, we invited renowned pediatrician Dr. Vasant Khalatkar, who has dedicated over 40 years to transforming pediatric care through community outreach, national health campaigns, and social advocacy. His commitment to equitable healthcare has reached unserved children, tribal communities, and urban poor through innovative, measurable, and compassionate service. I am just giving a formal, very, very short intro for Sir because when I saw your achievement, Sir, actually you are doing so much for the poor and unprivileged child. Even on the second term, you are doing so much for even the medical students also, not only the poor and unreachable, even the reachable student of our medical fraternity, you are doing so much. At present, sir is national president of IAP. He is consultant pediatrician and neonatologist, and he has done so many actual academic involvement, so many. He is fellow guide of Diploma Child Health, vice chairperson International Society of Tropical Pediatric, National Chairperson Pediatric Infectious Disease Chapter in 2023, National Chairperson Academy of Pediatric Neurology Chapter, Organizing Chairperson of Pedicon in Nagpur, Past President COMHAD in UK, Director Colors Children Hospital for Pediatric Intensive Care, EBCIAP in 2009 and 10, and then again 2014 and 15. He has been editor of Pediatric Neurology Bulletin, principal investigator for co-vaccine study for 2 to 18 years of age group, principal investigator for typhoid, JE, hepatitis B, pneumonia, and vaccine studies. He has established charitable Corona Hospital for medico colleagues, and he is national trainer in various IAP programs. He is president of Rajkamal Sports Club, recipient of Dhanmantri Award, recipient of International Melvin John Fellow Awards, recipient of International MS Signature Award, recipient of Best President Award. Even he is the recipient of Best IAP President Award, recipient of National Award for ORS Promotion, Breastfeeding, Promotion, Adolescent Problem, Save Girl Child. One more thing I want to just listen from Sir only, that what the new initiative you have done for the medical pediatric our fellow colleagues, students.
Uh, uh, Thank you, Dr. Jyoti, for my brief introduction. But it's not
Sir,
really.
the original introduction, which I know, it was the almost 10 pages, sir. My whole podcast will dedicated to that introduction only.
Editing the broadcast. So, thank you, respected Dr. Sunita Tandulwadkar, Foxy President, the Secretary of the Foxy, and all my delegates, all friends, Foxy friends, IOP friends. I know there will be so many IOP friends will be there on this occasion of the broadcast. Really, because they love me. All the my members love me, and definitely with I'm supposed to be with the Foxian as my wife is Foxian, and I know the what are the amount of mammoth work you people are doing this year. Really, thanks to Dr. Sunita for her mammoth work, and this team. She has chosen such a good team. They are doing really the great job. once again, I want to congratulate you.
Thank
See,
you.
the what is the work this year IIP is doing? IIP is doing lot of work. Basically, we are trying to start to the three programs we are doing. One is the Triple E, that is the Education Enhance and Empowerment Program. So here we are discussing the cases from learning from mistake. So we present the cases that we usually miss and then we sort it out. Second is the academic institution. All over India, there are near about 750 colleges, and from that department of pediatric, we do the take the cases and we have to introduce the colleges. Suppose it's a Jipmer Pondicherry, we take the history and everything of for 15 minutes. What is the staff and basically it's a interactive. So suppose I go to Chandigarh, I should know the what is the Chandigarh. And third, this PG Academics. The PG Academics, it's our novel program. That's my brainchild. That we are we have chosen 300 topics which are for a PG curriculum, and we are making lectures by student only, those postgraduate student or senior resident, and they are presenting the topic and they get video through AI help. We are modifying this, and this all the 300 lectures will be available for the postgraduate student, so that if suppose any institute there is a no teacher, but some of for DNB, some institute don't have a teacher, but they don't have a time, or they can't make a 300 lectures in a year. So it will be very useful, and now it's getting a good success for this. So these are the few programs, so many social programs, but now we will move on to our
Yes.
topic, I think.
So actually, when you are so interested in actually just to rise and shine of our own PG students, now our topic is born to rise for our girl child. So just we first start from the
Yeah.
neonatal age or early childhood age. And actually this neonatal age or the early childhood age, it is the foundation of life. For a girl child also or a boy child also. So what are the most critical health priorities for the girl neonate in the first 28 days of the life? Because we see there are bit difference in the both the child, even if there is girl or if there is a boy. So what you in your pediatric practice you would have been seen that what are the most critical health priorities for girl neonate?
As a pediatrician or as a doctor, we should not differentiate that whether it's a boy
Yes.
priorities for the boy or girl. But most critical health priorities in neonate, that in first 28 days of is simple and very important is that is early breastfeeding. That's within the golden hour. Pure immunity and bonding magic. That's a really we need. That is my first message. Always you should keep the baby warm, ensure proper cord care, give vitamin K, prevent hypothermia, and maintain the hygiene. Delayed cord clamping. That is very important because the girls are more prone for anemia. Then, though biologically girls are often more resilient to certain infection, but human body is human body, whether it's a girl or whether it's a boy. You have to prevent them from infection. So you have to keep infection free. That's hygiene is very important.
So there must be some unique medical vulnerabilities to them also, which often go unnoticed. Many a times they just they
Yeah,
don't ask to the pediatrician. Sometimes they come to us, and there are some unique things like spotting they saw, or sometimes the mother is not even wanting to breastfeed the girl child. So there are so many things you as a pediatrician you have to tackle. So, means do
yeah.
they
This
face
is a
any?
very common thing. This is a very common thing, like a social neglect. Because see, still we are having a difference. Though India are reaching to height that playing cricket, girls are playing it. They are bringing the medals and shining India at highest level, as you say. You see they check the India and all these. You take the examples of girls, so many shining in chess and sports, and still there is a difference. There is a so many girls are skipped from feeding, delayed कंपेयर टू मेल सिबलिंग, क्योंकि हमारा 2 घंटा तो इसमें ही जाता है, लड़की हुई है उसी में जाता है वो लड़की गेटिंग हाइपोग्लाइसेमिया. सो low birth weight. But if suppose a child is less than 1 kg, nobody take care that when it's a girl child, nobody. It's a my I'm talking my personal experience. That's why nobody taking. They are not often ready to transfer to NICU. So definitely that is a growth. Somehow it's a magic only they can take it survive. But what about the future? Then emotional neglect, loss, cuddling, tackling, बच्चे को लेते नहीं है. It affect the brain growth. And definitely you have to go for some metabolic storage disorder like and sickle cell like this. That you have to take care.
Sir, actually,
Sure.
as a pediatrician, you must, and I, as being a gynecologist, I also must ensure the optimal feeding and nutrition for the girl child in the first 5 years because these are the foundation years. So, how can we just
Yeah.
ensure that? How can we just guide them, or how can we just, I mean, how do we just control this particular emotion of being girl child? वो दूध ही नहीं पिला रहे हैं या कई बार बच्चे को छोड़ दे रहे हैं. इवन तो आई हैव सीन सो मेनी टाइम्स इन द लेबर रूम पेशेंट शॉक में ही चली जाती है जब वी से कि आपको गर्ल
Yes.
चाइल्ड हुआ है. सो हाउ
Right.
हाउ कैन वी इंश्योर दैट दिस गर्ल चाइल्ड में दे शी शुड गेट द ऑप्टिमल फीडिंग.
Yeah, yeah. See, basically, when there is any girl child born, you have to talk with a mother, relative, and everyone that this mother is just not a, this girl is not a girl. It's a future, your future. They are going to do that. You have to give a lot of example what is happening, what girls are doing, and then initiate her for exclusive breastfeeding at least for 6 months. No shortcut, no substitute. You have to hamper them. You have to tell them and introduce home cooked complementary foods after 6 months. By that time, other can take care. Then you have to go for a regular clinics, whether it's a primary health center or to the private practitioner. You have to go for a regular weight, height, developmental checks. And so important is that while feeding, equal portion for all kids and love and food must be shared.
So when these small young kids, just today as our topic is girl, so we are talking about girl, but it is actually fitting on the boy and girl both. When they are coming for you for regular checkup to you, so there must be some early signs when you can just take that this particular patient, this boy or girl is going under the deficiency. So what certain signs you are just telling the parents or even to your gynecologist कि क्या
Yeah.
देखना है इवन व्हेन द किड्स आर कमिंग टू माय क्लिनिक व्हेन देयर मदर इज प्रेग्नेंट हम ही लोग उनको बता देते हैं कि व्हाई योर फोरहेड इज सो प्रोमिनेंट व्हाई योर स्मॉल किड इज गेटिंग सो मेनी वो पूरा स्वेटिंग हो रहा होता है तो वी जस्ट से कि जाओ अपने पीडियाट्रिशियन के पास और जरा विटामिन डी कराओ या कुछ कराओ. So there must be some early signs we have to tell our patients and we have to just inform them what they
Yeah.
are.
Very good question that everybody should know, everyone should know that, and you are recognizing that excessive setting is going on there. Like, see the pallor, dull hair, poor appetite. These are the all early red flags for the anemia. Then frequent infection. It's all that those goes in favor of malnutrition, whether it's a SAM, whether it is a kwashiorkor, and delayed milestone or irritability. This is the brain is feeling the hunger first, so there is always the irritability. Always keep an eye on growth curve. Even as a gynecologist, you also ask the mother that are you keeping the growth chart? That is very important. Always a nourished girl grows into nation strength, one spoon, one smile at a time.
सर एक्चुअली व्हाट हैपेंस जब भी उनको बताते हैं कि योर गर्ल इज वी आर जस्ट सीइंग दैट गर्ल इज एनीमिक दे आर सेइंग नहीं मैडम बहुत गोरी हो गई है. तो वी हैव टू जस्ट टेल ये गोरी नहीं हुई है एक्चुअली शी इज बिकमिंग एनीमिक. एंड actually the, just you rightly said routine growth monitoring actually it helps in detecting all the malnutrition and anemia in early stages. We have to just tell them again and again कि आपके बच्चे का फीडिंग कैसा है या आप कैसे खाना खिला रहे हैं. Now the second aspect, तो national wide we are going far ahead for this vaccination program and immunization program. Everybody is so keen कि उनके बच्चे को सारे वैक्सीन होए सारा इम्यूनाइजेशन होए. But still there are some common myths around immunizing in the girls. and how do we just address them, and can we just know कि क्या बोलते हैं, क्योंकि वी आर सीइंग हमारे यहाँ तो टिटनेस लगाने के लिए भी प्रेग्नेंट वुमेन कहती हैं कि मैडम आप टिटनेस लगाएंगी तो इसका मतलब है आप इससे सीजर ही होगा, आप नॉर्मल नहीं कराएंगी, दैट्स वाई यू आर गोइंग टू गिव अस टिटनेस। आज के जमाने में भी इवन टिटनेस टॉक्साइड का इंजेक्शन लेने के लिए पढ़ी लिखी महिलाएं भी मना करती हैं। So same with the immunization in the girl side. So what that type of myths you can just tell, and how do we address them? That also
Yeah,
you
yeah.
can.
You have perfectly says that whether this is a they feel like this is the indication. Like if we say डीपीटी लगाना है तो सर हमारा बच्चा गिरा ही नहीं तो जन्म भर गिरेगा ही नहीं तो क्यों टीटानस है डीपीटी लगाना है क्यों ये पोलियो लगाना है पोलियो तो खत्म हो गया अभी बट इट्स नॉट अ फैक्ट in spite of all our effort, only 83% we could reach to 83% of total vaccination. This is all because of some myths. Some communities are there. They are not ready to accept that vaccination is the birthright of every child. And what is a myth? Girls don't need all vaccine. Truth. They need every single vaccine with equality. Whatsoever, it's not a vaccine, never right scientifically that it's for girl, it's for boy. And it's the biggest example is we want to have a cervical cancer. We want to approve that's HPV vaccine, which is very preventive. And you, thank you, all obstetricians, though it's a part of a, you started from a 11 year, but you are taking a lot of effort and your president is also doing lot of work with the IMA, that cervical cancer vaccination promotion. And thank you, Foxy, for that. Always keep record, safety immunization and immunization card is very important. Suppose that girl goes to फॉरेन खुदा ना खास्ता हो कि चले जाए वो फॉरेन दे व्हाट दे आस्क whether you have taken this vaccination और वो टाइम इतनी पढ़ी लिखी बच्ची अगर उसको वैक्सीनेशन का चार्ट नहीं बता अगेन दे कम टू आइदर यू और मी एंड आज सर आज मेरे को वैक्सीनेशन लगा दो व्हाट इज दिस सो वैक्सीनेशन इज अ बर्थ राइट इट शुड गो
Yes,
राइट
so at the during the antenatal period only we have to just make them aware कि vaccination जरूरी है, whether it is a girl or boy, whatever it will deliver, you have to give the vaccination and immunization. Second, we have seen in comparison to boys, the girls are having the disproportionately higher level of the anemia in the adolescent girl. Means now, not the neonate, now the adolescent girl. These are 12 years, 14 years, 15, 16 years girls. They are just coming to clinic and they are having the anemia. So what may be the root causes of this type of anemia in our school going girl, adolescent school going girl?
yeah, yeah. Adolescents, the commonest cause is the blood loss due to their periods or menstruation. But in spite of government, the Anemia Mukh Bharat scheme, we are giving, doing the deworming, we are giving the iron folic acid tablet. They keep the iron intake due to poor diet, social neglect, and see its loss. That is a मेरा तो क्या अपने वो टीवी पे एक बहुत बड़ा एडवर्टाइजमेंट दिखाता है वो लेडी घर की खाती नहीं है सबका खाना हो जाता है पर मेरा तो क्या मेरा तो दिस इज द सेम थिंग लड़की बाद में खाएगी देन parasitic infections are very common and now the trend of a junk food that to be very important one should have a one notion against that we are doing that against junk food then gender bias then cultural fasting practice is very common and that to be done by small children especially adolescents girls like if you see the ईद का प्रोग्राम हो हरताली का प्रोग्राम हो या करवा चौथ हो वो बच्चों से की जाती है वड़ा सावित्री हो जो लड़कियों से जो फास्टिंग है that are the causes of anemia mainly loss in menstruation.
एक्चुअली दिस इज द सोशल स्टिग्मा, बचपन से ही लड़कियों को बहुत सारे के फास्टिंग प्रैक्टिसेस कराते हैं, नॉट द बॉयज। वी सॉ ऑल द फास्ट एंड एवरीथिंग, सोमवार गुरुवार मंगलवार एवरीथिंग इज डूइंग बाय द गर्ल। इवन पढ़ाई भी अच्छी करनी तो उसके लिए भी फास्टिंग गर्ल्स ही करेंगी। अच्छा पढ़ाई करने के लिए बॉयज दे आर नॉट फास्टिंग, वो अपने आप पढ़ाई कर रहे होते हैं। सो देर इज समथिंग
Yes,
विद द
correct.
सोशल थिंग, बट देर मस्ट बी
Right,
सम
right.
प्रैक्टिकल साइंस when we just
Yeah.
when the mothers are coming to you, you must be telling before doing test, because they are not readily agree for doing the test upon their child. So there must be something you were telling to your patient कि how do just assess कि ये बच्चा anemic हो रहा है। हाँ,
सबसे पहले बता दिया कि people doesn't agree they first say the मेरा बच्चा गोरा है it's
हाँ,
not anemia बच्चा फुला रहता है, दिस ऑल इडिमेटस रहता है, मेगालोब्लास्टिक एनीमिया रहता है. जब अपन कंजंक्टिवा देखते हैं तो इट्स अ पेन, बट स्टिल दे आर नॉट रीड. अरे हमारा बच्चा तो मोटा है. दीज आर द मिथ, मोटा, गोरा. सो you have to tell them, these are, you have to see the palms that are pale, lips, nails, even vagina, even nail bed. These are the all things where suppose we always say कि लिपस्टिक लगा हुआ है तो कहाँ दिखोगे, नेल्स पे नेल पेंट लगा है तो कहाँ दिखोगे. Then the remaining is the your palm में मेहंदी लगी है तो क्या करेंगे. So the vagina is the last part you have to see where you can see the pallor. Then this is the simplest I will say simplest mirror of health, this pallor. Then fatigue, irritability, ये बच्चे बहुत irritable है. और the important thing is that the scholastic performance, they get damaged. There's a decrease in dramatic decrease in scholastic performance, and they are always for a recurrent defection and always have a slow recovery after illness.
Yes, we have to
These
just
are
see
the
if
all
the
signs.
yes, we have to see the girl is going to be irritable and not attending the school properly, or she is getting fatigue again and again. Then we have to be very clear about that. This may
One
be the
more,
sign.
one more is that the pica, that
Yes,
habit
chalk.
to
Yes.
eating non-food items like mud or ice or karke baad. So anemia doesn't shout; it whispers through pale cheeks and tired eyes. Listen early, act fast.
So there are so many nutritional mistakes the mother and father, means parents are doing with the school going girl. Can you just elaborate? Because I have seen उनको टिफिन जिस स्कूल में टिफिन ले जाते हैं every day they are taking paratha and achar. They are just taking paratha, achar, parathe ka roll. So there are so many nutritional mistakes also the parents doing. Can you just tell a word of wise words to them?
I have already told about the junk food, but there is a they are using some community using polished rice, bread, fried snacks, calorie rich, nutrient poor. Just बच्चों को calorie मिलना चाहिए. Then ignoring protein like a dal, eggs, paneer. They are boy food. They are saying कि eggs, paneer. Some communities saying egg, paneer and boy food. They are a boy food. This most of the students skip the breakfast also because the toilet habits or like that. Too many tiffin treats and too few greens and fruits. But so many tiffins are like included. And using food as a reward or punishment gives the natural hunger cues. Sometimes आज खाना नहीं मिलेगा तुमको, क्यों नहीं मिलेगा, तुमने ये गलत काम कर दिया. These are the few factors where the nutritional mistakes we are doing.
So we have to just teach them to just affordable and culturally accepted diet foods. Like अगर पराठा अचार लेके ही जाना है तो they must actually make ingredients like palak or methi or some green vegetables with the paratha. Means we have to just make their tiffins. We have to just make sure that girl is also eating three times this meal and with the actually heavy high protein and high iron and folic acid there. Now when the puberty time comes, most of the time that particular years 12 years to 17, 18 years, the girls are skipping to go to pediatrician also and they are skipping to go to the gynecologist also. उनका national immunization chart, they just completed all the immunization till the age of 12 years. और उसके बाद जब तक उसको बहुत ही सर्दी खांसी बुखार या वायरल नहीं हो जाता उसके लिए भी वो अड़ोस पड़ोस से ट्रीटमेंट ले लेती है. मोस्ट ऑफ द टाइम जब वो लड़कियां बड़ी होने लगती हैं दैट टाइम दे जस्ट स्किप्ड गोइंग टू द पीडियाट्रिशियन. और छोटी है तो गायनेकोलॉजिस्ट के पास भी नहीं जाती. वो 4-5 साल उनका बिना डॉक्टर के निकलता है. सो दैट पर्टिकुलर टाइम the parents have to start preparing girls for their puberty or menstrual hygiene. So as a pediatrician, what you will tell to the parents about the red flag signs of the abnormal puberty? Because कभी कभी वो इतना देर से आती, व्हेन यू आस्क 17-18 साल की एज में वो अप्रोच करती है पीडियाट्रिशियन को. देन पीडियाट्रिशियंस आर सेंडिंग दीज पेशेंट्स टू गायनेकोलॉजिस्ट एंड तब तक थोड़ा लेट हो जाता है बहुत सारी चीज़ें डायग्नोस करने के लिए. तो आप मीन्स आई जस्ट वांट टू नो कि क्या आप 11-12 साल की एज से ही दैट मीन्स यू जस्ट ट्राइंग टू प्रिपेयर दीज गर्ल्स और देयर पेरेंट्स अबाउट द प्यूबर्टी और मेंस्ट्रुअल साइकिल?
My sincere advice to parents, this is very important advice, that you should start conversation with your child by the age of 8 to 9 before the body changes, not after. Basically use simple body positive language कि क्या होने वाला है, कि it's a natural not secret. Then they have to teach the hygiene, emotional changes, what is going to happen, respect for privacy. Always father should also involve, because normalization begin at home. Show her how to track her period, empowerment, and some red flag they should know. If it comes before 8 years or after 14 years or 13 years maximum, then it's a too early or too late. Breast development before 8 years or no signs by 13 years need evaluation. Excessive hair, acne, deep voice. These are shows the possible no, hormone imbalance, rapid weight gain, dark skin teaches. These hints at a PCOD, and growth spurt stopping too soon could signal early puberty closure. So these are the signs they should know. These are our red flags also they should know.
Actually, when we have to just tell them that at least 1 to 2 years they will take for the establishment of the menstrual cycle also, and there are so many menstrual disorders, but as you know nowadays everybody is googling everything on the internet. Even the 8, 9, 10 years girls are also googling. Many a times there are not PCOD, but the girls are coming to the clinic saying, "Uncle ji, mujhe to," or auntie or uncle, that I am having PCOD. Though PCOD is rising, means it is on the rising trend in the adolescent. So, what are the earliest symptom parents should watch for PCOD?
Actually, we are having a clinic with a obstetric gynae by Pragati and mine is pediatric.
Yes.
Whenever I enter, at least
And
one
Pragati
or
is so good in the PCOD, placenta create. There are
young
some talks, some
correct.
topics where Pragati is so excellent. So PCOD is one of that thing that Pragati can talk
So
so
whenever
good.
I enter and when I saw the a girl at the age of 8, 10 years or 15 years, I always direct her to Pragati. That I came to know. It's a my eye at that. So every parent should know that whenever there is an irregular miscarriage, the first and last out, excessive hair on face, chest or back, persistent acne that persists routine care, and there is a weight gain, then one should suspect PCOD. There are always again mood swing, tiredness, this was that. And this is known as a teen drama. So these are all signs of PCOD.
Sir, so this PCOD is somewhere lifestyle driven also and somewhere genetic also. So how much it is the genetic and how much is the lifestyle driven it is?
In most of the cases, it's a lifestyle link that like inactivity, junk food, poor sleep. Genetic adds some risks, but habit pulls trigger. So we have to take care of genetic you can't avoid, but you can take the care of 60 to 70% PCOD, which are lifestyle.
So actually, we have to just tell them about the irregular menstrual cycle during the puberty. If it is becoming again and again irregular, we have to just raise the concern about this. Now, sir, you had talked as a normal parent, they are coming to you, coming to us, and we are just guiding them. But still, we all are seeing there is so much gender inequality and there is so much about the social health about the girl child. So there are so many invisible barriers also. So how does this gender bias impact the health of girl children? You just told about this infancy and teens. So how does you counsel these families who prioritize the health of male children over the female children? हम एज ए गायनेकोलॉजिस्ट तो उनको बोलते हैं कि अगर आप एक लड़की का अच्छे से परवरिश नहीं करेंगे तो आगे फ्यूचर में शी विल बिकम मदर, शी विल बिकम द हाउस होल्ड हेड ऑफ अनदर फैमिली, वो ठीक नहीं रहेगा. As a pediatrician, how you counsel these families?
Yeah, it's a simple example. When there is a you gender bias, it's a impact that definitely it is going to help impact the growth of child. Suppose if we want to start early, girls often get smaller milk bottle and delayed medical visit. This is the very common. अरे लड़की को तो कुछ नहीं होता है ना, कुछ नहीं होता है हम लोगों को. वही लड़का थोड़ा सा भी चीखा खासा तो भी इमीडिएटली चला. इन एजुकेशन ऑल्सो प्रायोरिटी, बच्चे को अच्छे को बड़े स्कूल में डालेंगे, लड़कियों को बाहरी को प्राइमरी स्कूल में डालेंगे. नो स्पोर्ट्स, बच्चे ने क्या खेलना है. So you have to take the back seat to domestic growth. There is a limit growth. There is that what is the leading that limits the growth. लड़कियों की shorten height, मैंने इतने लड़कियों को देखा कि short height. If you go into history, there is always a two boy, एक one girl, and She is always on back seat in food and everything. So there is a limitation of growth. There is a lack of confidence and opportunity. बच्चों को खेलने ही नहीं देंगे, उसके इमोशन के साथ निकलेंगे. Then there is emotional neglect. What is the पहला, घर में कोई भी गेस्ट आया उसके साथ बात मत करो. कोई लड़का आया तो बात मत करो. ड्रेसिंग सेंस तुम्हारा वैसे ही रहना चाहिए, पूरा ढका हुआ रहना चाहिए. You have to don't become cheap. It's a pattern. It's not a girl. She want to show herself, but father, mother, what they say, don't talk too much with boy. Don't dream big, and you keep away from outside. So mental issues. What is happening? वो लड़की को जब ऐसा बोला जाता है कि 10 लोगों के साथ बात मत करो, ये मत करो, तो क्या होना है, उसका क्या ग्रोथ है? So mental health issues often go unnoticed because she is obedient, और ऐसे गर्ल को obedient माना जाता है.
So there must be some practical tips you can give for the families who are just not giving the equal opportunities. So how can we just give some few tips to the parents to just ensure the equal opportunities and confidence building in the girls? Like हम हमारे पास आने वाले लड़कियों को बोलते हैं कि see I am the doctor, I am so independent, I am doing everything by my own. हमारे जैसे आपकी लड़की बनेगी, we just motivate them. As a pediatrician, how you just give the practical tips to those parents?
Actually, most of the you said कि आज की लड़की कल की मदर बनने वाली है. See, we want a happy, healthy mother. So first we have to keep them in a confidence. Mother, father, we have to take in confidence and gently but firmly remind that a healthy daughter become healthy mother. The nation's foundation. That is very important. तुम्हारा जो कोई नातू बनेगा, तुम्हारा ग्रैंडसन बनेगा, ग्रैंड डॉटर बनेगा, he should be, if you want a healthy, then treat equally. Share real outcome. Actually, I always give the example of my daughter who become a IVF specialist. देखो, मैं अगर उसको जेंडर बायस रहता था, मेरी पहली लड़की है, दूसरा लड़का है, मैं अगर जेंडर बायस रहता था तो आज वो लड़की ऐसी नहीं बनती थी. My wife, and you see the surrounding. You take the example of your wife. अगर वो अच्छा खाना नहीं बनाती तो तुम्हारी हेल्थ कैसे रहती थी? So this type of example, and always reframe the equality for family progress, not rebellion, and encourage both parents to attend well child visit, inclusion, health bias, and always for vaccination. Some you have to spare some time, use stories, no ceremonies, and transformation begins with empathy. Empathy मत करिए, उनको stories बताइए, करिए.
We have to encourage them. Actually, we have to encourage them. Yeah. So there are, sir, there we just have seen the behavioral changes in the puberty, the mood swings and behavioral changes and anxiety. But sometimes we just think कि अरे ये जब अभी बड़ी हो रही है इसमें तो ऐसा ही होगा. But sometimes we just neglect that there is a deep psychological issues also. There must be a few points where we can just demark the psychological issues with the normal behavioral change. नॉर्मली तो ठीक है, थोड़ा सा इरिटेबल हो गया, कभी बच्चा प्यूबर्टी है, थोड़ा सा हार्मोन स्विंग्स आ रहे हैं, बट देयर मस्ट बी सम साइंस वेयर वी कैन जस्ट सी कि इसको थोड़ा साइकोलॉजिकल इशू भी हो रहा है. नाउ इट इज सो कॉमन विद द स्ट्रेस ऑफ द स्टडी, स्ट्रेस ऑफ द जेंडर बायस और अनइक्वलिटी. सो just I want to know few signs of the psychological issues also.
Actually, definitely mood swings. The important is the mood swing. That suppose it's a normal mood swing. किसी लड़की के साथ झगड़ा हो जाता है, घर में आती है, वो temporary. This is the simple mood swing. That it can happen in normal. अपने आप ही कुछ हो जाता है, अपना झगड़ा होता है, तो एक 5 मिनट के लिए मूड स्विंग होता है, then again we become normal. But if there is a psychological impact, then there is a definitely सेल्फ हार्म करते हैं ये बच्चे, अकेले अकेले रहना चालू करते हैं, नॉट टॉकिंग विथ मदर फादर, बच्चों से टूटते जाते हैं, दोस्तों से टूटते जाते हैं, दे डोंट वांट टू अटेंड द स्कूल, स्कूल अपसेंटिज्म बढ़ जाती है. ये सब चीजें इन बच्चों में होना लगे. दैट शोज द साइकोलॉजिकल इम्पैक्ट.
सर वी आर
एंड
जस्ट
डेफिनेटली हाँ या
सर जैसे आप बोल रहे हैं कि ये सारी चीजें साइकोलॉजिकल इशू की तरफ तो इशारा करते हैं, पर समटाइम्स देयर मस्ट बी सम पर्सन हु इज हार्मिंग देम इन द स्कूल और द ऑन द वे टू द स्कूल, एंड दैट्स व्हाई द गर्ल्स दिस गर्ल इज जस्ट अवॉइडिंग टू गो टू स्कूल और आउटसाइड ऑफ द होम, बिकॉज देयर मस्ट बी सम पर्सन. एंड द पेरेंट्स आर जस्ट सेइंग किसी को बोलना मतलब तुमको परेशान कर रहा है, हमें बदनामी होगी. तो आई जस्ट वांट टू टेक दिस लिबर्टी टुडे to just say about something about the POXO, because my branch is the medical legal ethics and medical legal committee chairperson I am. So I just want to learn from you कि there are some misconception about the POXO. पेरेंट्स को लगता है कि हमने बता दिया किसी को तो शायद उनका बदनामी होगा. So I want to listen from you कि what is the common misconception about POXO that parents should know. उनको कैसे मालूम होना चाहिए कि POXO is for the safety of their girl.
Yeah, very good question, because most of the people don't know the meaning of POXO. Even we face a lot of things whenever we face this POXO. Even our maximum doctors also don't know about POXO. POXO, it's really myth that it only applies to stranger and truth. Most abuse happen from known place. This is the fact. So many movies, so many things that don't come out because just family relation or fearness कि दुनिया में हमारी क्या बदनामी होगी. The reporting isn't revenge, it's a responsibility. Schools and family must maintain the safe touch education as a routine, not reaction. Early awareness and protection is very important, because that your myth is that we it's only for strangers and those who are doing the extra. Like so, there one should teach that my body, my rules. Don't talk strangers with trust to instinct. Make consent every language. Encourage open talk. If she can tell you about her day, she will tell you about danger. So that's the thing. That's a SPOXO.
Sir, as a parent, as a doctor, we have to teach them the body safety and for the consent, and we have to very closely observe the girl. कि if she is just avoiding going to school or parties or picnic, or she is avoiding to going in the some family functions, we have to just track her कि why she is doing such things, and we have to take her in the confidence. If sometimes the known persons also harming the girl, so they should be taken in the confidence, and they have to tell. We have to tell them कि if we are going in the POXO, that is not for the harmful thing for that girl, it is harmful for that boy or that person also,
Yeah,
because sometimes the teachers, the sports teachers, the bus drivers, conductors, even the roadside people, they are doing harm to the girls, even the body shaming, everything we are seeing. So we have to teach them about the safety and the consent. And
correct.
nowadays, when they are not telling, there are so many behavioral problems. Sometimes they are having so much stress, sometimes just for the sake of fun. और कई बार साथ वाले बोलते हैं अरे तू तो बहुत ही ऑर्थोडॉक्स विचारों की है, हम सब क्या कर रहे हैं तुम भी करके देखो. So we are seeing the rising trend of the substance abuse also. We are so many school going girls or boys we are seeing taking the substance. So when we see these girls, they are using these things. There means we have to just identify the behavioral signals. So as a pediatrician, what you are seeing in the girls which are using the substance?
The first and foremost thing is he's usually sudden changes in his behavior. Substance abuse people, excessive sleeping, not going to school, not attending, self-harming, some sleep disturbances are there. They want to have their own world first thing, and then you see the pockets of the that you can get. If you can't reach funding, stealing the money, that is also one of the thing. And they are mainly lonely. If you can find it out, smoking, smell from there, always in drowsy state. These are sometimes omitting, sometimes complaining of abdominal pain, and you can see the behavior of the, and parents are the best person who can judge whether it's a substance abuse or not. You can, we having a short film, very good short film, that's a Disha, prepared in my tenure as a president. That's a Disha. We have shown the all signs symptoms of substance abuse, and it can, how can we fight against substance abuse if we want a very good rehabilitation center, we can do the best against it. It should not be make a ego point कि मेरे बच्चे को सब कोई ड्रग का आदत है तो वो बच्चे का क्या होगा, मेरी कितना बदनामी होगा अगर छोड़ दिया, तो पेरेंट कैन डू अ वंडर.
Sir, actually, one point you actually pointed out so good, stealing, because I came to know about one patient. She was stealing from her father's pocket for the substance, and they are affluent family, and they are again and again saying कि उनकी maid चोरी करती है. And after that, when they saw the behavioral change in the girl, then they come to know that this stealing is going by the daughter only. So this is a very important point to how she is funding this substance. We have to keep track. Second thing, there is nowadays the girls are so much concerned about their body, their face, everything. So this body shaming is in the there's a now a very trendy term we are listening, and sometimes we are just seeing that body shaming. The girl is obese and everybody is doing body shaming, so she just want to sleep alone. वो घर में ही पड़े रहना चाहती है, वो बाहर जाने से अच्छा नहीं लगता है. So how we can encourage these girls about the lifestyle changes or preventing the lifestyle diseases like obesity? Sometimes this is due to some genetic disorders, or sometimes this is due to just maybe some disorder. But if this is just because of the lifestyle diseases, so how we can just motivate her to reduce the weight and everything?
Yeah, again, this second subject which I like, and again on this also we had a second picture, that second movie, that U-turn. U-turn is on available on online. That's a YouTube. That's a U-turn by IAP. So child obesity, really, India is going past. Second country that obesity is in a developing country. See, initially it was not like that, because all the child, when we were children, we were going to school on our own feet. We were playing. There was absolutely playing time. No TV, no screen time, nothing was there, and that is the major issue. And junk food. So these are the important factors. One is the junk food. One is the screen time. So which contains high calories, low nutrient. Then emotional eating triggered by stress, comparison, or body shaming. You already told. Then lack of structure sleep. What children need? At least 7 to 8 hours sleep. अपन सब लोग बोलते हैं कि अच्छे है, साथ के लिए 7 से 8 है. ये बच्चे सोते का है, ये तो स्क्रीन टाइम पे रहते हैं ना. The screen time is also divided up. There should not be screen up to 2 years, after 2 to 3 years, 5 years, 5 to 7 years. This is the sorted screen time, and that to be very healthy screen time. Then parents modeling poor habit, like children copy, they never listen. हम लोग बहुत बार फोन पे बोलते हैं कि अरे मैं तो घर में नहीं हूँ, फोन पे बोलते हैं, बच्चे वैसे ही सुनते हैं, और वो बताते हैं कि अपने को कि पापा आप भी तो बोल रहे थे ऐसे. That's
We have to
again.
actually present a good example in front of them by exercising or eating good, actually. Sir, now this is our segment, the favorite segment, the rapid fire round. These are the quick questions, quick answer, and straight from you. जब जो आपके दिमाग में आएगा, no thinking, no pausing.
Yes,
जैसे
yes, yes.
क्वेश्चन आएगा, आप क्या जवाब देते हैं?
Good, good.
So, just
I am
one.
not in a Karan Johar show.
Sir, one food every girl should eat daily.
See, need of iron. So, bowl of sprout, nuts, and jaggery.
Yes. Most underrated nutrient for growing girl.
Vitamin D.
Okay. Iron tablets morning or evening? What your pick?
Evening. Probably before meal, so that absorption is good. And you should have some lemon, like a vitamin C containing fruits, so that absorption should be good.
One habit that instantly improves a teen's health.
Drink enough water and sleep 8 hours minimum.
One sign of anemia parents always miss.
Loss of interest and fatigue.
What is the one thing every girl should know about her period, first period?
It's normal, natural, and nothing to hide or fear.
So, if you are for your girl patient, PCOS in one line, genetic or lifestyle.
Lifestyle.
One myth about puberty you wish you could erase.
That this period, this is a very bad myth, that this period make girl impure or weak. See, in our still this era, girls are avoiding going to temple, going to school activity when they are in that period. So that's the biggest myth that girls are impure.
Okay, so my next four question actually you answered in your this one thing only. So the next question is one POXO related tip every parent must teach.
Yeah, that your body is your body. It don't allow to touch anybody without your will.
Yes.
Will.
One behavior that builds girls' confidence instantly.
Repeat, please.
One behavior that builds girls' confidence instantly.
Parental support.
One thing school must do better for girls' safety.
This is a very important question. That safe reporting is very important. That safe reporting system must be there, and sensitization of all the staff. It's not only teacher, including class 3 level people also. You know that Gurgaon Kissa. So you have to sensitize all the staff. That is very important.
Sir, actually, in our Indore, I belong to Indore. So there are in maximum school, there is a compulsion of the support staff in the bus. The lady support staff in the bus. Bus is not driven by only conductor and driver. There are two ayabais or two aunties in the bus. Same.
Very
The whole time there are two aunties, ayabais, who are sitting in front of the toilets, the girls' toilets. These are two major safety issues with the girls because these toilets, the common toilets and the bus. These are the two places where the girls are feeling
yeah,
unsafe.
yeah.
So the second, your favorite quality in today's girl. I know you are a proud father of a promise, very intelligent girl, and now
Basically,
who is
confident. They are confident, updated, smart, and techno savvy.
and one message for every girl who is listening this podcast.
I know there are so many girls. As you said, ki girls. That's all girls sitting. You are sitting here as smart and techno savvy. So help your parent, grandparent, and give something to society. Today, you make a aim that we have to give something society, something to society.
One message for every parent of a daughter.
I really congratulate that you are a father of a daughter. Just support her and let her work on her own path.
And one thing you wish society should stop doing to girls.
That discrimination and inequality. We saw in just to take the example of our hospital when there is a IABI and ward boy, that there is tremendous difference of payment. That discrimination and inequality should be stopped.
Sir, you just told us so many times that parents should take care of the girls, they should build the confidence. So if a teen opens up emotionally, what should parents say first? Because लड़की बहुत दिन से कुछ बोल नहीं रही है, but then she opens up to emotionally. So what
Yeah,
their
yeah.
father or
That's a really a great moment. That should be moment that parent should be proud of her and cuddle her and tell her that I am glad that you shared this with me.
yes, sir. Because girls are very close to father. So if the father is saying, I'm so glad that you I just thought about telling this, that the girl will feeling so relaxed. So just I want to complete, though I just made this title, but still I want you to complete this title. I completed in my way. I want you to complete in your way. Girls are born to,
Uh, Let me just a minute, just a second. Girls are born to yeah, girls are born to lead and change the world for the better.
yes, sir. I just sake of very small title, I made this girls are born to rise or shine. But I wanted you what you are saying. So, as a renowned pediatrician, you have changed so many girls' life, so many parents' life, because we have seen so many patients. They are crying, बार बार रोते हैं, कितना खराब लगता है. एज ए गायनेकोलॉजिस्ट हमको समझ ही नहीं आता गर्ल चाइल्ड बॉर्न करने के बाद. कभी कभी तो लगता है ये फीस भी देने वाले हैं कि रोने इतना रोने वाले हैं कि इनको समझाने में ही 2 घंटे जाएंगे. So, what change do you hope to see in the next decade regarding girls' health and empowerment?
I to say कि whatsoever boys or gents are doing, that should get all things should get done by girls. That should be the change, and equality should be there. Gender equality, total gender equality there. Only the thing, gender equality should not get misused, which happens sometimes. It should not be get misused. That's my as a respect and as a sincere advice that be equal, be it, but don't misuse that equality.
Yes, thank you. Thank you very much, sir. One last word I want to listen from you for our gynecologist colleague also. These all are for, this is for the general public. This actually podcast is aimed to doctors and general public also. But one sincere word of advice for your gynecologist colleague. Sometimes we also make mistakes. Sometimes you also say, अरे ये क्या लिख के भेज दिया, ये तुमने देखा क्यों नहीं था? So we just want you to know, just like we do some mistakes in the antenatal period, and when you saw the child you just think अरे तुमने पहले देखा होता. I want one advice from your side to all the gynecologist friends.
Yeah. So these are mistakes are naturally it's going to happen, whether it's by pediatrician, whether it's from gynecologist. There is a one lesson from learning from mistake, that you have to learn lot from mistakes. First and foremost, important thing is never utter a single bad mouthing or bad word about your colleague, whether they are junior, whether they are senior, whether they are gynecologist, physician, or somebody. But even I think you should not have any complaint in front of patient to your staff also. That is very important. You should have a healthy relationship, and important as communication with a pediatrician and gynecologist is very important. We are having a very good program with Fogsi and IIP. That's Sat Sat. You must be remembering either Sat Sat and it's a
Still we are doing the Sat Sat CME every
yeah.
year.
That is the thing. It is today is the need, because sometimes it happens we unknowingly we tell something to the parents, and that they take it the other way. Then if you try to convince those कि अरे मेरा तो ऐसा बोलना नहीं था, मुझे ऐसा बोलना नहीं था, but still they अरे जम्मा जम्मी कर रहे हैं, अभी तो कोई तो होगा गया, गायनेकोलॉजिस्ट ने इसको झापा होगा या इन्होंने कुछ गायनेकोलॉजिस्ट को बोला होगा. तो communication is very important in them. So my main thing is that gynecologist, pediatrician is a one team. So they should be always साथ.
थैंक यू. एंड सर आए जस्ट साथ साथ हम और पीडियाट्रिशियन साथ साथ हैं, पर सर आपकी बेटर हाफ जिनके कारण आज ये पॉसिबल हो पाया कि हम आपको इस प्लेटफॉर्म पे ला पाए. शी इज़ अ वेरी रिनाउंड गायनेकोलॉजिस्ट ऑफ नागपुर, एंड शी इज़ एक्चुअली वेरी एक्टिव फॉक्सियन, डॉक्टर प्रगति खलाटकर. मैं चाहूँगी, अभी आप बहुत सीरियस बात हो गई है, तो मैं चाहूँगी कि 2 वर्ड्स आप उनके लिए बोलें, क्योंकि गायनेकोलॉजिस्ट कैसे बिहेव कर सकती है आपको घर में भी समझ में आता होगा. सो यू आर सो प्रो अबाउट टैकलिंग योर अनदर गायनेकोलॉजिस्ट. हेलो प्रगति. सो आई वांट टू लिसन 2 वर्ड्स फॉर प्रगति.
आप बोलेंगे कि मुझे आप इसको मस्का मार रहे, बट व्हाट्स एवर आई एम हियर, दिस इज जस्ट बिकॉज ऑफ हर साथ साथ टू मी फर्स्ट थिंग. एंड मुझे 3 साल के लिए फॉर द चाइल्ड हेल्थ टू टेक केयर ऑफ चिल्ड्रंस एंड 50,000 पीडियाट्रिशियंस के लिए छोड़ दिया. आई एम रियली थैंकफुल टू हर for her noble gesture.
Thank you.
Really.
Thank you very much, sir. Actually, I am telling her also because as a gynecologist, we need to know the pediatrician's perspective, even the cardiologist, even the orthopedic, because sometimes the women, they don't want to go to the specialty. They just come for everything. They are coming to the gynecologist. So you are so lucky that a gynecologist and that too like Pragati is your wife. And thank you very much, sir, for this very informative podcast. And if this
Yeah.
time permits, if we get another opportunity, we would like you to talk to you again, sir. Thank you.
Yes.
Thank you very
Thank
much.
you.
Good
Thank
luck.
you, Dr.
Actually, I should say you had such a wonderful
Really,
question bank.
wonderful
My
question.
God, it
Really,
was
really
amazing.
wonderful question.
I
Amazing.
was
It's
listening to all the questions.
basically
So
this
nice.
is the it's for our program, the IIP की बात community के साथ. I will take this podcast and I will share to all these because
Thank
we are
you.
having that link on
Thank you
IIP
very
की बात.
much, sir. Actually,
Really,
this aim and the inspiration, everything is just Dr. Sunita Tandulwadkar, madam. She
that's
inspired us so
actually
much. When I did
Dr.
my first and second podcast, I was so nervous. Even as I was writing question again and again and again, means I was like, ये मैं कर पाऊंगी कि नहीं कर पाऊंगी. And for first 2 or 3 podcasts, she was joining 10 minutes prior to the podcast, just consoling us कि you will do it properly. Don't panic, don't panic. And now this is the 281 podcast, and we all are feeling so humbled and so elated because it is our chance to interact with the different faculty apart from our own gynecology.
Yeah,
So we are just dedicate it all to our beloved President Dr. Sunita Tandulwadkar, madam. She bestowed us with this opportunity, and that's why we are here. And we are thinking, हम और कौन सा गेस्ट ला सकते हैं कि हमारे व्यूअर्स को उसके लिए थोड़ा सा फायदा हो. So
yeah,
this credit goes to madam. Thank you, sir.
yeah.
Thank you.
Congratulations to
Thank you.
Sunita madam, and that is the thank you for her trust on you. That's a
Thank
trust. One
you.
point is very important for a parent and children relationship is that is the trust.
Yes.
That is very important relationships.
Yes, the
So
trust is
not
the
like
key. Yes, trust
uh,
is the key thing, and that trust on the chairperson's madam has shown. That's why this podcast is actually continually going on.
yeah. Yes, yes, yes.
So
Thank
I'm
you.
taking. Thank you. Thank you.
Thank
Good
you.
night.
Good night.
Good night.